The next Trump administration's public health team has taken shape this week, including 3 new picks for key roles that were announced on Friday. Here's a look at where we stand. For director of the Centers for Disease Control and Prevention, Trump picked Dr. Dave Weldon, a physician and a former U.S. congressman who has advocated the extensively debunked and repeatedly proven to be false claim that vaccines cause autism. He's Trump's pick to run the CDC, an agency tasked with disease prevention, including with making recommendations for vaccine and immunization schedules. For Commissioner of the Food and Drug Administration, Trump has tapped Dr. Marty Makary, a surgeon and Fox News contributor who opposed COVID vaccine mandates for the general public during the pandemic. He's Trump's pick to run the FDA, an agency whose mandates include approving vaccines. For Surgeon General, Trump chose Dr. Janette Neshiwat, a physician and also a Fox News contributor who's currently a medical director at CityMD, a chain of urgent care centers here in New York City and in New Jersey. She specializes in emergency and family medicine. Earlier in the week, the president-elect chose the former TV doctor Mehmet Oz to lead the Center for Medicare and Medicaid Services, CMS as we call it. Dr. Oz has expressed vaccine skepticism and pushed junk science and debunked medical misinformation throughout his career as a TV talk show host, including, by the way, promoting supplements and health advice, much of which is not supported by any evidence or scientific study. He's promoted weight loss supplements that don't work, colloidal silver for colds and infections despite no evidence of their efficacy, and he promoted hydroxychloroquine to treat COVID, which was later deemed useless in the treatment of COVID by the medical community. Dr. Oz has also invested heavily in multiple healthcare and pharmaceutical companies, some of which were tied directly to the agency that he was tapped to run. Now, each of these positions and agencies falls under the Department of Health and Human Services. HHS, as it's more commonly known, handles a budget of over $1.7 trillion annually and sends more funds to states than all other domestic agencies combined. HHS has about 85,000 employees and plays a huge role in promoting health, wellness, and disease prevention, both domestically and around the world. So, given all that, Trump's choice to lead that critical department is none other than Robert F. Kennedy Jr. He's an environmental lawyer by trade, but over the years, he's pushed anti-vaccine viewpoints. He said just year that, quote, "There's no vaccine that's safe and effective," end quote. He's also posted a lot of medical misinformation, including several debunked claims linking vaccines to various medical conditions, as I mentioned earlier, including autism. He's suggested that the government should remove fluoride from water. He's suggested people consume raw milk, risking exposure to illnesses like listeria and E. coli. And he has in the recent past urged people to resist CDC guidance. He's been vocal in his skepticism of the COVID vaccine. He's been linked to conspiracy theories suggesting the COVID pandemic was planned by the government as a means to control the public. COVID was planned by the government as a means to control the public. Trump chose RFK with the promise that he would, quote, "let him go wild on health," end quote. And while RFK Jr. has said he won't ban any vaccines, he continues to promote distrust in vaccines and the expert-run institutions that are built to protect our public health. He's pushed flat-out false statements that erode public trust in our top medical institutions, which will likely discourage people from opting to get vaccines that prevent deadly and debilitating diseases. Public health programs, especially disease prevention, work when they are enacted on a large scale, generally by the government. When an effort to inoculate a population against a disease works, it is and should be largely invisible to the public. The absence of an outbreak, the lack of a crisis, is proof of a successful public health program. No one notices when it works because that's the point. Nothing has gone wrong. When your public health system is strong, you don't notice that kids don't get measles or polio or whooping cough. For instance, in the 1950s and the 1960s, just before vaccines became publicly available and use became widespread, the U.S. saw more than 500,000 cases of the disease, and hundreds of people died from it every year. You can see it here on the top left. But now that Americans routinely get the measles, mumps, and rubella vaccine during childhood. The Mayo Clinic's most recent annual count found just 13 cases of measles, 621 versus 162,000 before there was vaccine; of mumps, 6 cases of rubella versus 48,000 before mumps. Take a look at this. Diphtheria, smallpox, polio, eradicated. 0 cases, 0 cases, 0 cases. There were 200,000 cases of diphtheria. Now there are 0. Despite that, the CDC has found that vaccination rates in America are falling. Since 2019, childhood vaccination rates have begun to decline. The CDC found that in the last school year, child MMR vaccinations, measles, mumps, and rubella, fell below the target rate of 95% in more than 3/4 of all 50 states. In the last year alone, more than 30 states experienced declines in vaccination rates across all state-required vaccines, including MMR, DTaP, which protects against diphtheria, tetanus, and whooping cough, and the polio and chickenpox vaccines. And what do you know? Measles cases, while still extremely rare, have been on the rise in the United States. Roughly 280 cases of measles have been reported in the United States this year. In 2022, the United States saw the first case of polio in more than a decade, and it appeared here in New York State. So now, 57 days away from the next Trump administration, which brings the promise of a public health apparatus run by someone who has pushed disputed, false, or dangerous notions about public health, it is time to get real about what happens next.